Okay, we're going to do the continuous wave Doppler waveforms on the Parks Flow Lab now. From your the main menu where you enter the patient's information and then the history, you can go under Test Select here, and then go under Doppler waveforms for the continuous waveforms. Now, one thing to remember when you're doing the continuous waveforms, if we look here as to how the vessels are coming out of the patient's body, so you're wanting to angle up into that vessel as opposed to being straight, because that will give you your better Doppler angle. So you're going to be at this kind of an angle because our vessel comes out at this angle and then comes down the medial part of the leg and then goes back behind the knee. So the first signal we're going to get is the femoral or common femoral artery. And always have a good glop of gel that you can scan through. I'm just going to show real quick here the glop. And when you're scanning, you're not necessarily going to be ever at this particular angle because that's 0 degrees and you're not going to get a good signal. You have a nice glop of gel so that when you do have an angle like this, there is going to be a space between the probe and the skin, and I'm pressing down into this a little bit, and that gel fills in that gap so that you always have a place for the transmission of the sound wave. So always have a nice blob of gel when you're doing your waveforms. So coming up here now, again, the common femoral, we're going to listen with our ears, and if we hear veins or such, just knowing our anatomy, right there we're hearing a vein. So that's telling me, since I know the vessels come out from the middle part of the body, vein, artery, nerve, more laterally, if I hear a vein, I'm going to move more laterally. I'm going to also listen with my ears for that triphasic waveform. Once I hear that, then I can adjust the size and if I need to, the position with my remote. I'm decreasing the size so it fits on the screen here. Once I get a good signal, then I'm going to hit my freeze and save button here. Let me just adjust again a little bit. And anytime, once I freeze it, I can always move over and get a different segment of waveforms by moving them with my arrows here. But if I like what I have, I just hit my save and it stores it. I'm going to mute it so that it doesn't make too much noise when I move my probe. So I'm going to move down to superficial femoral here. And again, when you're looking for these vessels here, you're going to be pressing in a little bit and then going side to side just very slowly so that you can listen and try to hear. So we're going to unmute it again here, and now we're going to listen and bring our volume up a little bit. I can hear that's nice and triphasic. Adjusted the size according to what I needed, and then I'm going to hit freeze and then save that. Now I'm going to come down to popliteal here. The patient turn their knee out just a little bit. When I do the popliteal, I'm going to come parallel to the calf and then press up in behind the knee a little bit. I'm going to start down this way and then slide up. I know the artery comes across this way and I want to be catching it as it's coming towards the probe so that I get a good signal, again, that's 60 degrees or less. This will be pretty much closer to 0 because of how I am angling parallel to the leg. I'm going to unmute it here, and again, listen as I'm slowly moving the probe medial to lateral or lateral to medial as I listen to find that. So now I found the vessel, and I'm going to readjust it until I hear that triphasic waveform, because I know I'm doing a fairly normal patient. Looking at the screen, I'm going to make the size a little bit bigger because I can hear nice. Okay, I didn't adjust the size, I just changed my window a little bit, and I got a nice triphasic waveform. Now I'm going to freeze and then save it. Again, I didn't change size, just my window. Freeze, save. You hear a little bit of Venus coming in there too, but I got it before the veins started to interfere. If you get venous interference, what's going to happen is it's going to cancel out your arterial signal, because one vessel is flowing towards the probe, one's flowing away, and again, the two working together is going to not give you a good signal because they're going to be working at canceling each other out. Now we're going to move down to the dorsalis pedis here. Actually, let's do posterior tibial first. Right at the ankle here, or medial malleolus. Get a nice big glop of gel. I'm going to turn on my sound, and then I'm going to listen here. And then slowly move as I'm trying to hear it. There, I can hear it. Then I'm going to look at the screen and see what it looks like. And you can see as I move side to side that it gets louder and then softer. And I want it where it's loudest, and it sounds, again, that triphasic signal. And then I'm going to freeze and save it. Now I'm going to move on to dorsalis pedis. I'm going to take my big lump of gel from the posterior tibial, and then I'm going to come over here where I normally would find dorsalis pedis. If you go in between the big toe and the first toe there, and look down right towards the top arch part of the foot there, we'll unmute it and see if we can hear that. Once I hear it, then again I'm going to readjust and try to get again that triphasic waveform. Because many times if I can't see a nice triphasic waveform but I can hear it, it all has to do with my angle. I need to get a better angle to get all three phases on the tracing. So I didn't move a whole lot. I went, if I show you here, I went from over here and then kind of moved around and then tried to find where it sounded the best, and then you've got to kind of look around a little bit sometimes to get the best window. And then we've got a much better waveform here, nice and triphasic again. Now the other thing to remember about dorsalis pedis is if you're approaching it where you just saw on the top of the foot, sometimes this waveform will be upside down, and that sometimes just has to do with how you're approaching the vessel. So if it looks something similar to to this where it's going upside down, you just have to change your angle and keep working at it to try to get it going towards the transducer. If for some reason you can't get it a good signal here, you can, you've got a signal, but you just can't get it to be, looking normal on the waveform but you can hear that it's okay. You can sometimes come up here a little bit where the anterior tibial comes down and comes just over the ankle and turns into dorsalis pedis. You can listen over here, and then you can see there we get a really nice signal as well. But of course, ideally, we want to try to see it as or listen to it a little bit farther down into the foot, because the farther down you listen to it, and if it's normal here, then it has to be normal all the way, you know, going up the leg there. And of course, with all these signals, if you have somebody who has some serious disease going on, it's obviously not going to be triphasic, but learning this way on a normal patient and how to listen with your ear, that you've got the best window and the best signal, when you do get those difficult patients, you'll have a much easier time. But the difficult ones are really where you're going to learn even more, but you should be able to get really good signals on patients, especially when they're normal.